welcome and thank you for joining us for our monthly webinar, Practitioner of the Month. I'm Chris Grout of MaxGen Labs. Today we have a very special guest. Many of you are familiar with Dr. Donnie Thompson. Dr. Thompson, a chiropractic physician, board certified in functional medicine and clinical nutrition, brings a very unique perspective to today's discussion. He runs Thompson Wellness Collective out of Brentwood, Tennessee. And Dr. Donnie believes that all the body's systems work in concert. If one system's out of tune, the whole body suffers. Today's topic is genetic gymnastics for mental health. We'll have time for a brief Q&A at the end of the talk, and feel free to drop questions in the chat as well. With no further ado, I'll turn it over to you, Dr. Donnie Thompson.
Thank you very much. I appreciate that. So I am Dr. Thompson. Like I said, I'm in Nashville, or outside of Nashville, and I'm actually having a little problem with something. Hold on just a second. Okay, there we go. Functional medicine, clinical nutrition, and chiropractic internist. I've been practicing for about 15 years now, and this has been a lot of fun working with MaxGen and learning what the genetics can actually do all around the board for your health. But today we're talking about what it can do for mental health. Now, you've heard of mental gymnastics. Well, we're doing genetic gymnastics for our mental health. So we're really just looking at what are a couple of genes that are going to be very contributory to things that are happening in our brain and our mental status. So a couple of fast facts. 1 in 5 U.S. adults experience mental illness each year. That is a pretty high statistic. 1 in 20 adults experience serious mental illness, and 1 in 6 aged 16, 17 experience mental health problem every year. The thing that I have on here, 50% lifetime mental illness begins at age 14. This is young. I mean, people, the mental struggle begins early. And a lot of these kids, the social dynamic is very problematic for a lot of these kids. Not just that, but you couple that with other problems that we can actually do something about, and you can help some of these people. Now, suicide is the second leading cause of death among people aged 10 to 14. That is frightening and saddening all at the same time. And I'm going to speak to this, my personal experience with this, in just a minute. But here's some more fast facts you can read. But like I said, 40,000 Americans die annually from suicide. Women experience twice as much depression as men. The cost of depression is incredible, as you can read. And they're just getting worse, and we're getting younger problems, and they're getting worse. So the suicide actually hits close to home for me because my father actually committed suicide almost 21 years ago. And there's a backstory with that. You can actually go to the website. The story's there. He actually was diagnosed with herpetic encephalitis, and he lost his short-term memory. And you've ever seen that movie 50 First Dates? 10-Second Tom was the guy you'd introduce yourself to, and then he would say, hi, I'm Tom. And then you're like, hey, Tom. Hi, I'm Tom. That was kind of him for like 5 minutes. And anyway, he said he'd never practice medicine again because he was a physician. And anyway, my mother's the type of person that says, by God, I'll show you. So they did alternative and natural medicine, and there were some pharmaceuticals involved, but not many. And in a year, he was practicing medicine. Well, his brain was never quite right, and they were using pharmaceuticals to try to do that. One of the side effects of pharmaceuticals was suicidal ideations. So one of my favorite things to do in the office is what's called a pharmacogenomic test. This is a test that actually will test your genes to see which drugs you should not be taking and which drugs are a better option for you. And it is way better than what we are currently doing in the system, which is the best guess. So while a drug may treat an issue and be good for that issue. It's not treating the person. By doing the pharmacogenomic testing, you are seeing what the person wants. So I'm not going to say I'm anti-medication, but I'm definitely pro-information and what's best. MaxGen is going to have this on their website. It is not up just yet. I will revisit this towards the end. So today we're talking about 4 genes. That's it. I mean, I could spend a lot of time, but I'm going to try to get through this very quickly. So the first gene, what we're doing is monoamine oxidase. This and the second gene is the MTHFR, methylene tetrahydrofolate reductase. A lot of you are very familiar with this, and it gets a lot of hype, but there's a huge story to MTHFR. We're just covering this much of it. DAO is diamine oxidase. It's a histamine gene. You think about histamines as allergies, but we can actually incorporate that into our neurological health. Nitric oxide, we think about cardiovascular, but it actually is a big deal for our brain. So, first of all, monoamine oxidase. This breaks down your neurotransmitters like serotonin, norepinephrine, and dopamine. This is very important. It can be high and it can be low. So let's talk about what the monoamine oxidase is. Anytime you have ACE in a word, ASE, it means enzyme, okay? Now you have a synapse. A synapse is 2 nerves junction together, but there's a space, right? There's a space right there. This one blows out a neurotransmitter and this one sucks it up. There's always something left over. There's a reuptake that happens, hence the serotonin reuptake inhibitors. And then there is an enzyme that helps break this stuff down in the synapse. This is what it does, okay? So this can work fast, it can work slow, okay? But the emotions that we associate with the neurotransmitters of the monoamine oxidase are dopamine, which are joy. It's also reward, but epinephrine and norepinephrine are fear and anger, and the serotonins. This says disgust, and sadness, but it's also happiness. So we do consider serotonin as a happy neurotransmitter. So if you have a slow monoamine oxidase, this enzyme the enzyme does not eat up the neurotransmitter between the synapse like it's supposed to, okay? So that means it stays in the synapse longer and can have a longer effect, okay? Now, if you have fast, it's just the opposite. It's eating it up too quickly. So that means the neurotransmitters will stay in there for a longer amount of time. So a shorter amount of time, excuse me, which means it's not going to have the same stimulus. So I debated on whether to put this into this presentation or not, but the monoamine oxidase is not just neurotransmitter. We actually have to think about the monoamine oxidase. So we think neurotransmitter, it actually has an immune function. Our brain is actually very much part of our immune system. And we have to think that the left side of our brain is more sympathetic and the right side is more parasympathetic, and the parasympathetic side is really important for good immune health, okay? Now, so we want to make sure those neurotransmitters are very balanced as much as we can get them. So there is a byproduct of this enzyme breaking this stuff up. A couple of byproducts. One of them is hydrogen peroxide. Hydrogen peroxide actually can act as a free radical. You can actually use it for, your body likes hydrogen peroxide at certain amounts. But we usually have these enzymes down in here called superoxide, glutathione, catalase. These things help break it down. So we can actually incorporate some other genes that do this stuff with our MAO to see if our neurotransmitters are actually affecting our immune function. But we also have this other little problem here. There's another, I got a special thing with ammonia metabolism, okay? Ammonia is not like, if you can't really, If you test the blood for ammonia, and it means you're either in liver and kidney failure, and that's not what we're looking at, right? We're looking at metabolism of something. So one of the metabolic byproducts is actually ammonia. And if you don't process the ammonia, you can actually increase your free radicals and affect your immune system. But it all goes back to that monoamine oxidase. Now, here's some symptoms of, this is fun. When we talked about slow and the fast, this can be a little fun, to say the least. Fun. So a slow monoamine oxidase, that means we're not breaking it down and we have more neurotransmitters in the synapse, right? Aggressive behavior kind of makes sense. It's getting stimulated. Antisocial behavior, confusion, extreme agitation, can actually affect your GI tract, and it can actually affect your muscles, okay? Fast. Aggression. Do you see what happened there? It's the same symptom. Just because you have one symptom, you can't narrow it down to one. That's why we do the tests. It's not a 1-to-1 ratio. That's why we have tests for all this stuff. Anxiety, social anxiety, carb cravings. This is really interesting. Your body's looking for a type of energy with carb cravings. There's other things that can make you crave carbs too, the dysfunctions in your gut. But again, your gut's a second brain. It's all gets super complicated, but we're trying to make it a little simple right now. So, but depression, definitely the seasonal depression, which can also be related to a vitamin D. So in their vitamin D SNPs too, and vitamin D genes. And if we have an MAO and a vitamin D, then we can really make a difference, might be able to make a difference in some people's seasonal depressions. So insomnias, low pain tolerance, low self-esteem, obsessive compulsive behavior, panic disorders, but you can see how this. So poor dream recall is an interesting one because you can actually associate poor dream recall to a particular vitamin, and I'm going to discuss that. So what are the cofactors? These are the nutrients that we need for that. So that poor dream recall, it actually goes into the B6. So the B6 alone, we've had people that will take B6 and a significant dose for a while, and we can see that their dream recall tends to go up, and they do better with that, and they get to a certain point where they start having weird dreams. We're like, okay, we got to cut that out. You got too much. Remember, it's all about balance. So riboflavin is B2 and niacin is B3. We have to have these. Riboflavin has become one of my favorite B vitamins. It's actually very calming. It helps out with a lot of other genetic factors, and we live in a place where we tend to be more sympathetic, fight or flight, and the B2 is very helpful for that. Magnesium. Nobody gets enough magnesium. It's really hard. Most of the time we check magnesium levels, like nobody's perfect. So it's definitely one of those you could always take. If it gives you loose stools, you know you're taking too much. Iron, again, you might want to be careful with iron. If it constipates you, you're taking too much. And tyrosine. Tyrosine, we start to get into neurotransmitters. Because tyrosine does help with making dopamine and norepinephrine. And so if you're taking medication, I would use caution and talk to your professional. So on to the next one, the MTHFR. What in the heck is it? So this is, again, we're talking about the ACE. These are all enzymes. This is the rate limiting enzyme for the methyl cycle. Now, it breaks down homocysteine, and you need this cycle, this methylene cycle, for DNA synthesis. But you also need it for so many other things. It's your neurotransmitters. It's it is, if you need it for your DNA, it is part of your essence, so to speak. So we talk about folate. as the MTHFR, that is the methylene tetrahydrofolate. So we do use that, but if we have low levels of folate, then let me go back. So we need folate for this. We're not talking about folic acid. We're talking about folate. And this is, like I said, this is a huge story. And I'm trying to give you the high points here. Okay. But if you have a problem with this MTHFR, it can decrease your amount of available folate, for which we need it for all those other systems. So, and when we talk about the genes, there's two types. Well, sorry, two main types. There's several, but there's two main types. And you can see those here. They're available for you. Not super important right now. But here's a list of the types of mental disorders that are actually associated with the MTHFR gene. This doesn't look very good, does it? So if you have the MTHFR, it does not mean that you have these conditions. So don't worry about that. But, and typically, and I put them here, which gene they're associated with, okay? But when you have the MTHFR, when you start looking at the data, it's not that it's just one thing. It's usually you have this with this, and it's the ones that, it's the combos that really get gnarly. But the thing is, it is a keystone for so many things. It is very important, okay? So what are the cofactors or the nutrients for the methyl tetrahydrofolate? So, I mean, you think folic acid, that would work, right? Well, you guys probably know as well as I do, that's not necessarily the case. Probably not a good thing at all. Now, what is this OMFA? OMFA is actually a word, but it's not really a word. It's an acronym. It means unmetabolized folic acid. Now, what does that mean? It means folic acid gets in the system and it doesn't metabolize. It doesn't get used, and it sits around. So there's growing evidence that suggests that this unmetabolized folic acid is actually causing damage to our cells. It can actually be causing damage to the DNA. Damage to the DNA can cause mutations. Now, when we're talking about our genetics, usually we're talking about polymorphisms, not mutations. But if something causes a mutation, that could lead to really negative health outcomes. So there's not a ton, but there is enough to raise the question, is folic acid hurting us? Now, for a lot of people, I don't think it is. If you look at some of the research, it's really a personal basis. I don't use it though. I don't use it. I wouldn't use folic acid, period. But that's just me. We're going to get down to like the MTHF, the methylfolates and the folinates, and then all the ones that the body uses better. So typically we're not going to use these, but there is evidence that shows some people can't use it. So, so the cofactors. Here we are. This is we're back to the B2. That's a big word. It's a big word for riboflavin. Okay, and the same thing for the NAD. This is, and a lot of people have actually started doing NAD IVs, which are very anti-inflammatory. They can be very helpful for a lot of people, but NAD starts with B3, and that cofactor, or the last thing is the SAMe and DHA. This is actually your omega-3. The omega-3 actually helps that cycle out so much. So the B2, just like we started with the other one, the MAO, the B2 and the B3, super important, very calming to the nervous system. It can help. So we like the folates, not the folic acid, B2 and B3, SAMe and omega-3s. On to the next one. So we got two more. This one where this gets a little funny. Okay, and it actually ties back in with the last one. Okay, this is diamine oxidase. How does histamine tie in with folate? Well, everything's connected, right? So this enzyme breaks down histamine. This is known as an immune chemical and released when exposed to allergies. However, it's also considered a neurotransmitter. Who knew? I think like, well, I get snotty in my nose or like get a cough or I get a reaction on my skin. There's actually a neurological side effect to that too. But this enzyme is present all over your body, okay? So small intestine, liver, kidneys, placenta. The eosinophils, they are an immune cell. It's a white blood cell. And usually when those are raised up, if you ever have some lab work, you can look at your CBC and see if you have an eosinophil. It's called the differential on your CBC. Eosinophils, typically above 3% for us. A lot of labs, the ranges change, and some of them don't even have a reference range. If they're above 3%, we start to ask the questions: are eosinophils or histamines a problem? Do we have an allergy? Do we have a parasite? Do we have things like that? But so those eosinophils can actually be a sign that the histamines are a little elevated. So there's 4 different types of histamine receptors, okay? H1, H2, H3, H4. Scientists are not creative people, y'all. So they kind of try to make it as easy as possible. So the H1 is found mainly in the brain, and there are, and the H2 is found usually in the digestive tract. Now, there are certain medications that work on each one. So a lot of times the antacids that you have, they're actually a histamine blocker. So there's proton pump inhibitors, and then you've got histamine blockers. And so that's what that works on right there. So Benadryl is actually they tout it as an H2 blocker, but it actually does a little bit of both. So that's actually why it makes a lot of people sleepy too, is because it hits the brain. Now, H3 and H4, H3 is found in the brain, but okay, I put down here H4 and it says mast cell on here. You can go down a rabbit hole with this, okay? So if histamines and mast cell, they are related. They are not exclusive to each other, sort of. You can have a histamine problem and not have a mast cell problem. But if you got a mast cell problem, you got a histamine problem. So it's all about the individual. So if you're going down a rabbit hole with this stuff, histamines are something that you can totally rack your brain about. So try not to do that and just get the test, try to take things a step at a time. So, so just don't worry about mast cell stuff. We're not doing that right now. So I just put in a diagram here. This is from PubMed. If you look, you can actually see where all these histamine receptors are and the issues or symptoms that are associated. So you got gastrointestinal tract, you've got respiratory, you've got your head, dizziness. Dizziness and headache absolutely be caused from histamines. Tachycardia, like rapid heart rate. That's absolutely. And then you got your skin, eczema, big one. Eczema is a big one. That's why one of your number one foods for eczema is actually eggs. And it's because there's a problem with eggs. They're one of the number one allergic foods that the human body tends to not like. So I just say, you know what? Get on old MaxGen, get you one of those food tests, because if you got some histamine stuff, you need to figure that out. So what is it? What are the histamines and the diamine oxidases going to be associated with in your body? The sleep and the wake cycle. So you could have a problem metabolizing histamines, and it actually messes with your circadian rhythms. It's crazy, right? The arousal system, this is not just sexual arousal, yes, but it's also mental arousal as well. Secretion of pituitary hormones. The pituitary is your master gland. This is going to control all the stuff: thyroid, adrenals, reproduction, all that stuff. It does everything. So that's why they call it the master gland. Histamines can actually be a problem for that pituitary gland. So changes appetite, cognitive functioning, and learning. Other symptoms. This is one of my favorite slides. Fatigue, especially after eating. So I got a test and I found out I had problems with almonds. I was eating almonds all the time. So what do you do when you have a test that shows a food? You get off of it, hopefully for 3 months, and you don't eat it. And then you go back to it and you try to reintroduce and see what happens. I did that and I was in a hurry. I was going from one place to the other, and I stopped in the house and I was like, I have no food. There's a jar of almond butter there. Took a big old scoop. I was like, I gotta have something in my stomach. So I did it. Within 10 minutes, I just got so tired. I was like, oh my gosh, what is wrong with me? And it was like, oh my gosh, it's the almonds. Almonds are, it's crazy, right? But so I do not eat almonds anymore. So fatigue after eating. Now there can be another thing. Fatigue after eating can actually be reactive hypoglycemia too, but we're not talking about that. We're talking about histamines. So headaches, including but not limited to migraines, super common with migraines though. So remember that. Pain, chronic pain, recurrent pain, allergies like we've talked about, and immune system dysfunctions. And autoimmunity is a kind of a red flag to have a histamine problem. But any recurrent problem you have, if it goes away and it comes back, goes away and comes back, this could be an issue. But the main three: digestive disorder, distress, migraines, and fibromyalgia. So that's that pain. And this is all in the medical literature. So how are we going to manage histamines and the diamine oxidase? Ready? That's right, ladies and gentlemen, diet. You can't fix your problems with food, but you sure as hell ain't gonna fix it without it. So this is extremely important. There are plenty of lists on the internet about how you can change what diet lists you should do. And like, there's a lot of overlap and there's a lot of contradictions. This one says this and this one says that. So there is a list that we try to keep it as general as possible. The lists on the internet, use at your own risk. But I'm going to give you a couple of big ones. Unfortunately, alcohol is a big problem. But what it does is it actually releases a histamine, but then it inhibits the enzyme that's needed to detoxify the alcohol and the histamine. So you actually screw yourself up, and then you screw up your process of trying to fix yourself. So that's what alcohol does. Now, again, like, you know, if you're not a mast cell person, mast cell people can definitely not. This is like a big no-no. People who have problems with the enzyme breaking it down, some people can have a glass of wine every now and then and be okay. A lot of this has to do with the overall load that you have in your body, like most other things. So that's what this comes into. But the fermentation, anything that's fermented. So we're talking yogurt, we're talking kombucha, we're talking sauerkraut, kimchi. We're talking like the good stuff can actually be problematic for people that don't break down histamines. And these are some of my favorite genes right here is the histamine genes. So this is the big one, okay? What are some things that we can do? Okay, B6 is see, we're talking about these B vitamins. B vitamins are just super important. And you can shotgun this with a B complex, but I kind of rather know who I'm dealing with and give them more targeted support with like a B2 and a 12 or whatever. You know, we try to kind of do that, but you can always do you can always do a complex, but it's not my favorite thing to do. And this, one of the reasons during a histamine problem, there are actually people with histamine problems that have problems with folate, like ingesting even the methyl tetrahydrofolate. They have problems with the folate, even though they've got the MTHFR and they need it. It is a super conundrum here. So there are people like that, and I've seen them. But what we do for them is we really try to focus on that B2 aspect for these people, and that's another thing with the histamine people that have the MTHFR. We really try to focus on the B2 because it is calming and it still helps out that methylation cycle. It's just a little, it's not in here. It's just a quick tip. Vitamin C in itself is actually a little bit of an antihistamine. Vitamin A is an overall immune modulator and does work for the histamines. The reishi, be careful. If you have a food allergy, you'll notice that most of these are nutrients. And the reishi is one of those, like, you just got to be careful with. Quercetin, number one pick for trying to lower histamines in general. Black cumin. This is black cumin seed oil. Fantastic stuff. It's an antihistamine. Works great on a histamine diet. It's antiparasitic. It's antiviral. It's antibacterial. They're actually helps with reproduction. Like the list goes on and on. Like, I'm just off the top of my head. Like, there's so many things this stuff does. I think they're actually treating cancer with it in other countries, or the research is trying to treat cancer with it, and they're having some decent results with it. But curcumin, everybody knows that. And then the diamine oxidase, you can actually take the enzyme itself to replace that with your meals. So on to the next one. It's our last one. Okay. Nitric oxide synthase, or nitric oxide. This is a blood gas. This does not mean blood gas. No, it's actually the NO is nitric oxide. That's just what it means. So while it's typically associated with cardiovascular health, it actually acts as a neurotransmitter too, and it is very associated with cognitive and emotional and behavioral processes. So in the brain, so CNS is central nervous system, PNS is peripheral nervous system, okay, somewhere else in the body. We got central and peripheral. So this is part, again, we go back to the sleep-wake cycle. We go to neurosecretion. That's the secretion of different chemicals from your brain, from neurons. Fluid balance. This is super interesting. We're talking about electrolyte balance. We're talking about not necessarily electrolyte, but our body's ability to maintain fluid status, and then in reproduction. That's just in the CNS. Now, in the peripheral, it actually inhibits. So it seems more excitatory here, but it's actually, and it's inhibitory here. This one place it does one thing and one place it does another. This is where balance is still key. It's always going to be about balance and trying to get that balance and keep that balance. It's a chore. But so in here, in the periphery, it actually calms down and relaxes smooth muscle in the GI tract, in the vascular system, in your veins, in your arteries, and even in the urinary tract. There are three types: enos, nnos, and inos. You don't necessarily have to remember this, but this is where a lot of people talk about nitric oxide, and then they don't talk about this. And this is actually the most important part about nitric oxide. You need more nitric oxide. You need more. You need more. Do you? Probably. But here's the caveat. The enos is endothelial. The nnos is neuronal, and the inos is inducible. Think about this one as inflammatory, okay? So there, it says just where they are. The endothelial goes in endothelial is the inside your arteries, the inside of the vessels, right? Neuronal, neuron, inducible, inflammatory. Changes in these, in the nitric oxide in general, is related to depression, anxiety, bipolar disorder, and schizophrenia. Now, these are pretty. We're talking about some pretty severe stuff, but people deal a lot, like depression and anxiety is super common. You know, bipolar is actually, the numbers are growing, and schizophrenia is nothing to balk at. Like there's a lot of people that are schizophrenic and schizotype disorders. So there's a whole basket of worms to unload there. So schizophrenia, here's where we get to the cool stuff. The schizophrenia was actually there was an increase. Remember we talked about this? And we talked about this. And here, schizophrenia had an increase in nitric oxide. Depression had an increase of nitric oxide. So down here, when we have more nitric oxide, we think, okay, I'm doing good stuff for my GI tract. I'm doing good stuff for my cardiovascular system. Up here, it is, if it goes, it's not 1-to-1 ratio here, but when we have elevations, we have associations with the schizophrenia and the depressive symptoms, okay? But it's not just increase of nitric oxide. This is an increase of the nNOS and the iNOS. They were paired. This is the crux right here. It is the two together, the increase of that are causing or related to the depression development, okay? So it's not just nitric oxide alone, it's the nNOS with the iNOS. Well, the nNOS, it kind of makes sense, neuronal, right? And the inflammatory, and it's inducible, I know, but I'm going to call it inflammatory. Those right there hitting the brain is like, boom, lighting a fire in that brain, right? So we talk about the brain, and there's a couple of brain things here, but look at this. It is suspected the elevations in the nNOS and the iNOS could also be related to Alzheimer's disease, autism, HTN is hypertension, Parkinson's disease, and rheumatoid arthritis. So we're talking about autoimmunity too. This, like, and we discussed that, but I mean, this is absolutely not just brain. This is immune system. This is inflammatory. This is your general markers for inflammation. Like, we need to be looking at this stuff, you know? So what are we going to do for nitric oxide? Well, the polyphenols are actually going to be very helpful to reduce the oxidative damage that happens, but these other things here, okay? Remember, we've got three types: the eNOS, the nNOS, and the iNOS. If we can do anything to just lower, or our body's going to make it, right? Our body's going to make nitric oxide. At least we hope it does. We want to reduce the amount of iNOS. If we can take that one down, we can get the benefit of the other two and limit our problems with that. So we're not, they say take arginine for nitric oxide. That might help, but it's more of it blasts out nitric oxide. You don't get to delineate which one or which ones you're getting. So using things like the hydroxycobalamin, this is a B12, you can use the adenosine or the methyl, depending on your genetic types. You know, some people need to watch those methyls, but hydroxy you're pretty safe with, okay? But the citrulline is another precursor for the nitric oxide, but the vinpocetine and the huperzine, these products are actually helping reduce the iNOS part of this. So you're going to make the nitric oxide, but you're going to reduce this. That's one of the biggest things that we can do at this point. The vinpocetine and huperzine can be super helpful for a lot of people. Now, this is where it gets a little hard to give you some specifics on, but our overall macro diet is going to have a big effect on our nitric oxide production in general. So the overall production of nitric oxide can be reduced when you have an overall, when you are overcarbed, okay? You're overcarbed. So if you've got a monoamine oxidase that's having you crave carbs, it could actually be screwing with your nitric oxide system too. See how this stuff gets tied together real quick? So we do have to watch carbohydrate intake. Saturated fat does, there are some people who can do it, some people can't. Some people can do it, but just as long as you're not overloading it and just eating a bunch of, I mean, bacon's great, but I mean, you don't need that much. And then reducing sodium. There are products on the market that have, I mean, we need sodium, especially being summertime, and it's been hot lately. Sodium's not necessarily a devil, but for someone that tends to be more inflamed in general, I would definitely watch the sodium content in whatever I was taking. So we need salt, but just watch it. So that is my presentation. I hope I made some sense and that it was informative. But I also have a link here to go to MaxGen. So screenshot this, do what you need to go to MaxGen, because in about one of the first things I talked about, one, you can get your genetic profile, but one of the first things I talked about was the pharmacogenomic panel. It is not currently on the website yet, but it should be within the next few days. So MaxGen was kind enough to give me a discount code for the people that are watching. It is Dr. Don 10, and you will get 10% off of whatever you're gonna get. So you could get a works panel. I like the works panel. I mean, if I'm gonna do it, I'm gonna do the works. So we get the works panel here and the pharmacogenomic. You'll get 10% off, and that will only be valid until the 10th of July. So just remember that. Dr. Don 10 until the 10th, because it's not up on the website yet. So I do want y'all to stay tuned and give you a little time to get that ordered, because if you're on medication, I just want you to have the right medication. The test is FDA approved, and whoever your prescriber is, if you have some conflicting information or information that conflicts with your prescription, then your doctor will absolutely help you out, and it's not even an issue. So there we go. I hope you enjoyed it. Thank you very much.
Fantastic. Thank you so much, Dr. Donnie. I do have one question that came in here, and then we'll have some space if there are any other questions. Someone asks, how do lifestyle factors such as exercise and stress impact nitric oxide levels, and how should I adjust these based on my genetics?
Oh, for sure. So yeah, definitely like I said, the dietary intake, that's going to be a big one. Stress is a killer. I mean, stress is a killer. It will absolutely lower it. I would suggest making sure if you have access to get some laboratory data, I do want to make sure that your cortisol is within a normal limit. You can actually also get neurotransmitter profiles as well to make sure that your sympathetic nervous system isn't just going out of control. The exercise is good. We like exercise, but you can overdo this crap really easy. And there's a lot of people that are overtraining right now. I mean, there's a lot of people undertraining too. So the exercise, you definitely need to exercise. But it's gonna be a personal thing, and a lot of people think that, like, yeah, I'm fine. 3 days a week HIIT training is wonderful. Weightlifting, I love. Pushing the cardio, pushing the cardio isn't going to be better. So running all the time is not going to be better than lifting weights. But I will tell you what, the way you can actually test this, they make nitric oxide test strips that you can buy on the market, and there's saliva, and you just spit on this little pad and you flip it over and you hold it, and then it's color coded. And after you leave it there, you see what color it is, and it will tell you what your nitric oxide level is. So typically you do these in the morning, but anything you're doing though, it's always going to be one. So you could do it with try the supplementation we mentioned. Definitely watch your macros. Look at your the exercise routine, and if you're doing all the right, what you think are the right things, test the nitric oxide in the saliva, and they're not expensive either. But you can test it, and like, well, something's not working. And if you think you might be overtraining, you're probably overtraining. So does that answer the question?
It does, and it brings up another question. Are these readily available, like on Amazon or something somebody can find online, these tests?
Yeah, absolutely. Yeah, they're yeah.
Is it more common for individuals to run high or low in nitric oxide?
So I would say it's more common for the low. It's definitely more common for the low, and so that's why really the nutrients we were talking about, the huperzine and the citrulline, vinpocetine, those and the B12, those things are going to, like, I think I presented it more of like, it's going to reduce the iNOS, but it's also going to help you with the other two that are actually helpful. So they're more adaptogenic. You know, everybody's into adaptogens, right? Those things are actually adaptogenic for that nitric oxide. So it'll do both of those things.
Excellent. Great. Any other questions for Dr. Don Thompson? Well, that was fantastic. That was super informative. Thank you so much for joining us for our Practitioner of the Month.
Well, thank you very much. Happy to be here.
All right. Thanks, everyone.